Chairman, we are now live.
Good afternoon and welcome to this virtual meeting of the Health and Wellbeing Board at the London Borough of Hillingdon, which is being broadcast simultaneously on the Council's YouTube channel, Hillingdon London. My name is Councillor Jane Palmer and I am Chairman of this board. Before we start, some important housekeeping for everyone present. Please ensure that any mobile phones around you are on silent and that any home listening devices, e.g. Alexa, are turned off. Please keep your microphone muted when not speaking and then unmute to speak. As Chairman, I will call on those to speak during the meeting. In terms of technical meeting control, if any statutory voting board member leaves the virtual meeting partway through for a period of time, for example, a lost connection, I will continue the meeting unless we are not quorate, which is 5 members. Before we move on to the agenda, I'd like to ask Nikki to do a roll call of the councillors and others present to confirm attendance.
Thank you, Chairman. When I call out your name, can you please indicate whether or not that you are present? Thank you. So, Councillor Susan O'Brien.
Present, Nikki, thank you.
Councillor Ian Edwards.
Present, Nikki, thank you.
Councillor Martin Goddard.
Hi, Nikki, I'm present.
Councillor Eddie Lavery.
Present. Thank you, Nikki.
Dr. Ian Goodman.
Present.
Lynn Hill.
Present.
Sandra Taylor.
Present.
Sharon Day.
Present.
Dan Kennedy.
Present.
Patricia Wright.
Present.
Vanessa Odlin.
Present.
Nick Hunt. Nick, are you there? So you're on mute.
Sorry, I hate this. Sorry, yes, I'm present.
Brilliant, thank you. Richard Ellis.
Yes, Nikki, I'm present.
Sarah Crowther.
Present, Nikki.
Caroline Morrison.
Present, Nikki.
Fran Beasley. Sorry, Fran, you're mute.
I'm present. Thank you.
Thank you. Councillor Nick Dennis.
I'm present.
Kevin Byrne.
Nikki, I'm present, thank you.
Gary Collier.
Present, Nikki.
Right, is there anybody else attending the meeting that hasn't yet been mentioned? If you can please indicate now. Okay, thank you very much. Thank you, Chairman.
Thank you, Nikki. We will now move on to the agenda. Apologies for absence. Nikki, do we have any?
We have got apologies for absence, Chairman. We've had apologies from Councillor Douglas Mills. We've had apologies from Tony Zaman, and Sandra's here as his substitute. Apologies from Robin Duran and Graham Call, and you've kindly agreed to Vanessa Odlin attending the meeting. We've had apologies from Bob Bell, and Nick Hunt's here as his substitute. Apologies from Sheikh Odlin, and Richard Ellis is here as his substitute. And I think that's it, Chairman.
Thank you. We'll go on to agenda item 2, declarations of interest before the meeting. I'll take it that there are no interests if nothing is declared after the short pause that I'm going to give you all now. Lovely. Unless anybody sees anything, I think that means that we have no declarations of interest. Agenda item 3 is to receive and agree to the minutes of the meeting on the 1st of December, which we all should have seen. Once again, I'm going to take the minutes agreed unless there are any amendments, and I'm now going to give a small pause. Thank you very much. So I'll take those as agreed. Agenda item 4 is the exclusion of press and public. So the agenda items 1 to 9 will be considered in part 1, and agenda items 10 will be considered in part 2. So there will be a short pause while when we come to the end, so that I can go into agenda item 10 in part 2. I'm going to reorder the agenda because Patricia Wright needs to leave the meeting early, so I'm going to reorder the agenda that we take item 5 and move on to 8 just for the THH update, and we'll then go back to items 6 and 7 and return to agenda item 8 so that the remaining key partners can provide their updates, and then we'll consider 9 and 10. I'm going to rely on Nikki to make sure that I do exactly what I've just read out. So thank you very much. Before I start, I just want to welcome everybody and thank you for attending today's Health and Wellbeing meeting. I know many of you are fully focused on handling the current pandemic and the pressures that continue to have on health and care services across the borough. With that very much in mind, I've suggested that we have a smaller agenda than we would normally have, one that focuses on the current live and urgent issues so that we can check progress and understand the pressures that exist and agree ways forward together. We've not commissioned papers on a range of issues for this reason alone, but we'll refer to them at our next meeting. I want to focus on COVID response and recovery issues, and then hear on the progress regarding our vaccinations. We'll hear from partners. Partners will give updates on the current situation from their perspectives and what we need to do, and whether there are anything that needs to go forward under this board. Starting then with agenda item 5, which is the board member update. First, we just need to confirm that there are some changes to our membership, which are set out under recommendations on page 11 of your papers. Excuse me while I flick open my agenda. So you can see that I'm welcoming some new members. Councillor O'Brien, welcome to you as the recommendations in the report. Welcome to you as Vice Chair. Hopefully I can see Patricia Wright in my top right hand corner. Hopefully Patricia and we will get to meet eventually when this situation calms down a bit. So the recommendations are as on page 11 of your agenda items. Is that acceptable to everybody, those recommendations? Lovely, I can see lots of nodding heads. Thank you very, very much indeed. So welcome to all of you that are on the board for the first time, and we have some new cabinet members, 2 of which are here today, Councillor Lavery and Councillor Goddard. So welcome to you. Okay, so we can now go on to the agenda item 8, which I've put in there, which is the THH update. Patricia, I think that's you. Do you want to give us a little bit of an update? Thank you very, very much.
Thank you, Councillor Palmer. I appreciate that, and thank you for accommodating me joining and speaking earlier. We're in the middle of our board seminars this afternoon, so I've dropped out and I will drop back in again. So I haven't been to a Health and Wellbeing board in Hillingdon before, so thank you for the invitation. It is my intention that I or my Deputy Jason Sees will attend these meetings on a regular basis. What I thought I would do is I'll give you a quick update on the current state of play in the acute trust, but I'm also happy, if it's appropriate, to take any questions if there's anything I've not covered. So just to update the committee, the last 3 months, so by that I mean December, January, February, have been very busy within the acute sector. Just to give you a flavour, in the first wave of the pandemic in April, the highest number we reached in terms of inpatients testing positive for COVID-19 was 100. At the peak in January and early February, we had somewhere between 160 and 170 patients in the hospital who tested positive for COVID-19. And our normal funded bed base for ITU critical care is 9 beds, and we have been running with 15 beds occupied in our ITU and in our theatre suite for that 3-month period. So it's been a very intensive period for the Trust. I want it put on record that our staff have responded magnificently despite the high levels of sickness. So we've had a lot of staff who are local residents. The prevalence of COVID in the community has been high, and we have had a number of staff off sick with COVID, which puts extra pressure on staff who are coming into work. And they've also been having to juggle, like everyone else, children and homeschooling and so forth. We have put in a comprehensive programme of staff support in terms of health and wellbeing, and quite an enhanced programme compared to the first time round, particularly focusing on mental health, supporting staff with financial issues and so forth. And to support that, we've had a really, really strong partnership with our partner organisations in Hillingdon. So the Hillingdon Health and Care Partnership is a very strong partnership, and we've worked very closely with them in terms of discharge planning, how we're working with our care homes. So I have to say, having come from another local area where we also had a very good working relationship with our acute trust, I would really commend the fact that it's a very strong local health and care partnership here, and that has made an enormous difference to flow through the hospital and care of patients. We're in a situation at the moment where our numbers have started to drop. We're currently running with around, it varies on a day-to-day basis, but we were down to about 80 patients yesterday. We're back up to 89 patients today who've tested positive with COVID. Our ITU is beginning to become less busy, but it is still pretty busy, and certainly it doesn't feel for us yet like we're through the pandemic in any shape or form. So I just wanted to highlight that. I think that's probably all I wanted to say about the COVID pandemic. In terms of the Trust, I've now been in post since the beginning of December. So I'm at the end of month 3 as well. I do now have a complete executive team, and we are very much in the planning phase before the beginning of April to develop our recovery plan in response to the regulatory issues and the scrutiny that Trust has been under. So that's all I really wanted to say, but very happy to take questions or to add more if people have areas I haven't covered.
Patricia, would it be possible just to give us a little bit of an update on the rebuild?
Yes, certainly. So I'm not sure how aware people are, but there is a process for a rebuild or redevelopment of the hospital. We have to go through a 3-stage process. So a strategic outline case, an OBC, and then a full business case. So a strategic outline case, an outline business case, and then a full business case. Normally that would take you somewhere around 5 years to get to full business case. And then you would be talking about the rebuild happening in a sort of 5 to 10 year period. We're in a very concertinaed process, which, given how long we've been waiting for a new trust on the Hillingdon site, is actually really exciting and very positive. So the strategic outline case was signed off by the Treasury in October, and in fact we received our confirmatory letter about that yesterday. We are now in full planning mode for the outline business case, which we plan to submit in somewhere between August, September time. It just depends. We've got some work to do on it, but that's the kind of planning time. And we currently are at the point where we have draft 1 to 500 drawings of what the new building might look like. And then before we submit the outline business case, we'll have to get to 1 to 200 drawings. So again, a lot of work going on with partners. We're talking to the planners at the local authority. we're working very closely with our partners in primary care and in the community sector, and with our staff internally. But our plan is that we will have an outline of what the building will look like and the next phase of the approval process done before the end of this calendar year.
Thank you. Do those plans include looking at how you're going to cope with moving patients and getting people that are in hospital ready for this huge transition, decanting people to other places? How far along the thought process are you with that, please?
So as you're probably aware, because of the state of repair of the buildings, we have got some upfront funding for modular builds on the site, which will help us with the decant process. So we have two modular buildings, one which is on site called Modular North, and that will be completed by the end of March and will house 2 wards and our critical care unit. And then Modular South we're doing the enabling work for that at the moment. The cranes are, if not on site, about to come on site. I think they were coming on at the weekend. And Modular South will house things like our paediatric unit, which you're probably aware we had to move last year because the original building was sinking. Once those two are on site, and that will be completed by September, we will then start to demolish the area on the site that has the single level huts, essentially. So that will clear that part of the site, which will allow us to do the enabling work for the redevelopment. In addition to that, we're currently undergoing a programme of refurbishment of the wards in the tower block, largely because of fire requirements, but we're taking the opportunity to modernise the wards whilst we're at it. So they're not ideal wards, particularly not ideal when we've got additional infection control measures, but we are certainly making them a lot nicer than they have been. So that's our decant strategy. There will be some decant of wards to Mount Vernon in the interim. Some of the wards that are on in that area where the low-level buildings are, but that's in line with the care we provide anyway, in terms of it's probably going to be elderly frail services, and we've already got some elderly frail services on the Mount Vernon site, so they will move there in the interim. Thank you, that's very useful. I can't see on my screen whether anybody else wants to ask any questions. Doesn't look like it. I know Patricia needs to go and will come back, so maybe if there is something we can ask that. Am I right in thinking no one wants a question? Okay, Patricia, thanks ever so much for taking the trouble to come early. Hope to see you later. If not, I'll be in touch about us actually having some meaningful conversation together. Nice to meet you even over this medium. Thank you very much indeed. Thank you. Okay, so now, as I hinted at earlier, I'm going to take agenda item 6 now, which I believe is Dan Kennedy, which is our Health Protection Board COVID response and recovery issue. Dan, do you want to take us through this, please?
Thank you, Councillor Palmer. So just for board members, this is a regular update on our progress against our COVID local outbreak control plan, which we're required now to prepare an update on by the 12th of this month. If I start with infection rates, as you'll see in the report before you, we had a higher infection rate at the time of writing than is actually the case today. So the strong message and encouraging message is that we've now continued to see a steady decline in our infection rates. And actually, as at today, the update we received today is that we are 68.8 per 100,000 in Hillingdon, which compared to the update in the report that you have before you is 141.8. So that's quite a considerable drop since this report was produced. And in comparison as well, the other important message is now that we are below the London rate. London, as at yesterday, was 74.6, and obviously in the report, London was 117. So I think that's an encouraging position to be in. We mustn't obviously be complacent, but we're confident that some of the measures that we have put in place have continued to see that drop from that very, very high position of infection that we had seen previously. So that's a good news position to be in, but obviously we mustn't be complacent about that. If I move then on to updates more generally, and I should start by saying that the Health Protection Board, which is made up of a number of partners from the board members here today, have continued to meet monthly and have focused on some of the key areas of importance to implement our plan. I'll start by saying very briefly about the vaccine, as I know we've got an item on agenda item 7, which will cover this in more detail. But obviously the good news and the positive news is that we achieved our vaccination target by the required deadline, the 14th of last month. And not only did we achieve it, but we exceeded it, and I'm looking at Caroline, we're probably the best in the West, I think, weren't we? So it was encouraging. I think I know that our focus has very much been on the COVID vaccine, but I should also perhaps take this opportunity to highlight as well that prior to the rollout of the COVID vaccine, there was a tremendous effort to increase take-up of the flu vaccine. And so much so, and I'm looking at the latest figures that I think Caroline sent to me last week. I think, for example, over 80s, I think we achieved over 95% in terms of flu vaccination, which is incredible. And I think, just to put it into perspective, our target is somewhere in the order of the mid-70s. So it's an incredible achievement, and it's not something that's been achieved in Hillingdon. So that level of focus and attention has achieved a number of different, I suppose, health benefits for our frailer and older population. The focus is very much in terms of supporting the rollout of the vaccine, and we've just started to receive now some richer intelligence from the NHS around where there is take up and lower levels of take up, and what that's allowing us to do is to have a even more of a concerted effort to work with those community groups, those cohorts, those parts of the borough really where we need to engage more fully to help them, encourage them to take the COVID vaccine to help protect them and obviously and their families. In terms of the other aspects of our approach, contact tracing and testing remains very strong. So since we went live with contact tracing, we were one of the earlier boroughs in London to proceed with contact tracing. As a key part of our strategy, we've helped to track down more than 2,000 residents who've tested positive to ensure that they're obeying the public health guidelines. And obviously, testing is a significant part of our strategy. As we know, approximately a third of residents with COVID don't actually show any symptoms. So it's an incredibly important part of our strategy, and our capacity is wide for testing every day. I've touched on communications and engagement in terms of working with community groups, and through joint work between health and the local authority, we're in touch regularly with more than 150 faith and community leaders, and working with colleagues, we've been innovative in terms of our engagement. A number of those faith leaders have recorded videos, as have now increasingly some of our elected members, and they're being rolled out to encourage the take-up of the vaccine and help to allay any fears that there may be. We've secured funding as well for community champions. We're working towards about a third of the way through now, recruiting community champions who will be volunteers and ambassadors for public health messages and be an important contact point in the community for those community groups to essentially get some basic answers to any questions that they may have. And we're continuing to deploy our marshals to provide basic advice and guidance, and we're ready to do that again when some of the restrictions lift for return to retail. We've continued to respond quickly to outbreaks where those occur. So we're working closely with Public Health England, health colleagues and our public health team so that we provide that quick advice, quick support needed. And that has helped again to help stem the spread of the infection, and through social care, they've continued to be very strong and supportive to care providers. As we know, the residents of care settings are particularly vulnerable to infection and mortality. Where necessary, we have taken tough enforcement action against those premises who are clearly breaching the rules. And 3 times a week we meet with our police colleagues to share intelligence and target our efforts. And to date, we've issued somewhere in the order of 100 fixed penalty notices to premises who have clearly breached the COVID rules. And importantly, you know, that we do that as a last resort where that helps to keep people safe. I think finally, then, the focus, I suppose, looking forward and the priorities for us as a board, as a partnership, is very much on the rollout and continued rollout as quickly as possible of the vaccination, and hand in glove, working closely with our community groups, faith leaders, etc., to support that rollout. So engagement and communications is important, particularly as well, and that's the third priority for us. Is testing and contact tracing, so communications and engagement as well to support that particular strategy. So that's very much our absolute focus at this particular time. Thank you, Councillor Palmer.
Thank you, Dan. I mean, it really is a good report there about, you know, what we're doing as a community, and it's an excellent example of a very tragic situation, but local authority and health working together in our areas where we specialise in. You know, we know our communities. This is a shining example of how we are keeping our residents safe. And also thanks to Sandra Taylor, who I know has done some sterling work in the care homes. And I was at a meeting the other day when her name was mentioned in a London meeting. So thank you to everyone that is doing something, particularly on the health side. This is a shining example, as I've said before, about what we're doing. And let's hope it can continue when we roll out to the younger age group, which I think will give us a few more problems. Councillor Goddard, you have your hand raised. Do you wish to ask a question?
Yes, please,
Please do.
Chair, if I can.
Please do.
Yeah, Dan, thank you very much for the report. Very helpful. I mean, it's intrigued me for a while that our infection rates were that much worse than the average across London. Are you able to provide any indication as to why that is? And also, you know, we've seen quite a dramatic improvement. Can you attribute that to anything, please?
Thank you, Councillor Goddard. This is one of those areas where we've never been able to get, if I'm being entirely candid, a really clear answer. And I think it can largely, and I'm trying to sort of phrase this in a way without sort of attributing blame, because it's not about blame. It's actually about trying to understand what the patterns of transmission are. I think what's become very clear since schools have been closed, it's certainly slowed down that particular mixing cohort through the schools community. So I think it can probably be largely attributed to household mixing. There is a degree to which there is some evidence that there is mixing when people go shopping and then contract the virus, and I think the third group, but less so, which is pleasing, is through sort of the care settings. But interestingly enough, we were looking at this just yesterday, and there's a very, very clear, it's almost like a ribbon from Oxfordshire, Buckinghamshire, and into northwest London, and there isn't really an explanation that I've got that can explain that, but it's a very, I suppose, geographically it's clustered, and I can only therefore assume that there is there is sort of some household and mixing in the areas in which I've described, but it's not based on any science by any means.
Councillor O'Brien, you wish to ask a question?
Yes, thank you, Councillor Palmer. Thanks, Dan. Really interesting report and very clear to read, which is always very useful. Can I ask, are we going to be doing any monitoring on the fact that we have now got? I mean, it's been clearly laid out that that we have had to pull in community and faith leaders and people that are very high in the public eye to make some certain areas and cultures come forwards to have the vaccination. Will we ever work out whether this actually has worked for us, or are we actually already starting to see with how public opinion is changing with regards to public faces and people of notoriety going along that road?
Yeah, so in fact, and I'll give credit to Lynn Hill and Healthwatch, if I say so right at the start. And actually, we as a sort of board were quick out of the starting blocks to actually undertake a survey led by Healthwatch to actually almost understand some of the fears or concerns that our residents would have about taking up the vaccine to prevent the virus spreading. And there was some great research which was then shared with North West London, who then have built on that and undertaken some further research. And what was quite interesting, and this is about, if I'd explain, this is about understanding why people may be reluctant. And a big cohort of people who were reluctant was because they didn't understand enough about the vaccine and whether or not it was safe. And actually, they're the individuals who you can influence and encourage to take up. So in other words, by providing information to residents, you then start to see an increased take up. And the work that North West London did, which is our collaborative partnership, confirmed that individuals left those information giving sessions a lot more confident to take up the vaccine. And so your second point is about engagement, and we've had positive engagement from faith leaders. A number of faith leaders have offered their faith locations, premises as vaccination centres, again, so routing the vaccination distribution, administration in the community and in their faith sort of community. And so I think in summary, I think it's engagement, early intervention is working. And a final sort of example of this is that it's a piece of work that partners have done, is that we've targeted the sort of Simpson area as being an area where we saw lower testing. And I know we're talking about testing, but what we did is we leaflet dropped in that particular area. We worked with communities, and actually last weekend we saw a step change upwards in take up of testing. And so I think if you get the right information and delivered in the right way, and there's a variety of ways you can deliver that, so that residents feel informed about that choice, and if they're reassured that the vaccine is safe, you do then see a take up increasing as well. So that's where we want to go, is with our approach, is getting that intelligence about where there's low spots, engaging with the community and those community leaders, providing information and ease of access to vaccines, and hopefully, fingers crossed, we'll see that take up increase.
Really is a structured thanks. Sorry, Councillor O'Brien, cutting across there. That really is a structured approach to reaching communities that perhaps are a bit reluctant to engage. So yes, thank you to Healthwatch for your involvement in that. It's remarkable what we've managed to achieve. Anybody else have a question? I can't see. If there is somebody, please unmute and speak. I think that's a no. Okay, so yes, Dan, thank you for that. Thank you for all the work that we're doing, and our healthcare partners. Our residents are very, very grateful. I can speaking as a ward councillor, and I know my colleagues are hearing lots of really, really good feedback about what's happening with what we're doing here. So everybody take that back to their communities, please. We will go on now then to agenda item 7, which is the vaccination programme update. I think that's Richard Ellis, unless I'm mistaken. Good afternoon to you, and perhaps you'd like to lead us through the report. Thank you.
Thank you, Councillor Palmer. Thank you. You've had the report in your papers, and so I'll try not to repeat it. And I would just like to endorse everything that Dan Kennedy has just said about the calibre of the working relationships across the borough during COVID, and in particular for the vaccination programme. I think that's really been fantastic work across primary care, social care, the hospital, and the voluntary sector, and that has been demonstrated in so many ways. The report that you have is obviously a snapshot in time, and as you'd expect, things have moved on since it was being written. I'm very pleased to say that we fulfilled our target for the first 4 priority groups of Hillingdon residents, those aged 70 and over, and for health and care staff, and for clinically extremely vulnerable. And the latest figures that I've seen show overall around 88% of each of those groups vaccinated, with care home residents around 92% of the care home residents vaccinated so far, and we achieved that by the middle of February, as was the target. We're now actively working on the next 2 priority groups, groups 5 and 6. Group 5 are those aged 65 to 69, and we've already achieved around 80% coverage of that group. Group 6 is a much larger group. It's an age group running from 16 to 65, with underlying clinical conditions that might make them particularly at risk. And we're at around 2/3 vaccinated of that group already. We are hoping to complete that over the next couple of weeks, and we're awaiting a national, both a national and a London steer as to vaccination of the remaining between 50 and 65-year-olds. We've already vaccinated probably 1/3 of that population, and again we anticipate completing that over the next few weeks. So you'll see that those figures are significantly better than the ones reported in the paper. I think there are a couple of other things that I will say, and then I'd be very happy to answer questions if I could. You'll see on page 26 of your paper under section 2, there's a reference to the mass vaccination centres, and we had anticipated that 3 sites would be opened in Hillingdon. In fact, partly I think because of the amazing progress made by primary care and by hospitals and the community centres, we'll in fact only be opening 2 of those sites, one at the Compass Centre in Heathrow, and the second at the old vinyl factory. The Winston Churchill Hall at the moment is unlikely to be opened as a mass vaccination site, but we are looking, given its location, whether there are other purposes that it can be used for. The slight fly in the ointment that we're having to manage is that people close to this will know that the supply of vaccine to the vaccinating sites has been fluctuating. There have generally been high deliveries of vaccine from one week to another, but the actual quantities have varied from day to day. And this week and next week, there is a national challenge to the level of vaccine supply. So although we will be getting some vaccine in Hillingdon and elsewhere in North West London, it won't be at comparable levels as previous weeks. But we have been assured that the following week, and therefore the week beginning the 15th of March, that there will be plenty more than usual vaccine released. So I think over time, supply will be evened out. But obviously we're disappointed that we haven't been able to keep up the momentum this week. I think that part of the rest of the paper addresses aspects that we talked about in Dan's paper around initial reluctance by parts of the community to take up the vaccine. And I think, as everybody has said, the communication, the support by council leaders and by faith leaders has really demonstrated an improvement in confidence and a take-up of rates. And I think we don't want to be complacent about that, and we want to continue to soak up those who missed out on their first offer of the vaccine. And there's maybe more that we can talk about in the discussion. And I think clearly then we will be talking about resuming the second dose vaccination as soon as the first doses have been completed. A number of second doses have already been given, but the majority of those will be coming during the second half of March and into April. I think I'll stop there, Councillor Palmer. I can see that Dr. Goodman may want to make a comment. And
yes, Dr. Goodman, would you like to speak? I know you've got your hand raised.
Thanks, Chairman, and thanks, Richard. So just to add a bit more context, it really is a success story for collaboration, and just another identifying factor for that is if we look at the numbers of care home staff who've been vaccinated, and we know that throughout London that's been very low. In Hillingdon it's 73% of care home staff been vaccinated, which really is a very high figure, and goes to the hard work that Sandra's put in to encourage all these staff to get vaccinated. And of course we're carrying on working on that. Just a couple of other things that we hope to have vaccinated for the first dose vaccine, everybody in group 1 to 9 by the 29th of March, and given everybody their second dose by the 13th of June. And that, as Richard said, is contingent on vaccine supply, but we are assured that from the 13th of March onwards, we're going to get much larger quantities of vaccine coming in. The idea is that those groups outside 1 to 9 will be vaccinated through the mass vaccination centres, and the GPs will be doing the second doses, and only about 5% of the first doses for the other groups. And one other issue is that we are opening up another vaccination centre in the centre of Uxbridge in Boots, which should be opening at the end of this week or beginning of next week, which will afford people who are working locally there to have access to vaccination centres in the centre of Uxbridge.
That's really, really good to hear, isn't it? I mean, it is. Excuse me, just putting something down. Yes, that's a really, really good thing to hear. Once again, I keep saying it, but today is all about partnership working. Does anybody else have any comment to make on the report before us? Okay, so that's lovely. Thank you very much, Richard, for presenting that. Thank you, Dr. Goodman, for adding that very valuable piece. Okay, so now I'm going to go on to the rest of agenda item 8, if I may, and we're going to ask for some partners to give us some feedback. Could I ask that we keep it to I don't want to say brief, I don't want to say reasonable, but can I suggest that we go for about 5 minutes or so on a report from our partners? I'm going to ask Caroline Morrison to start, if she would be good enough to do so.
Yes, of course. Thanks, Councillor Palmer. And I also just wanted to say a thank you to the committee, because I'm here in my first meeting in my new role as the Managing Director for HHCP. So very happy to be here and very grateful that I've been included in the terms of reference. I can probably keep it very brief, because I think I mean, one of the things that's been great is that actually the integrated working has come through a couple of the updates that we've already had. So through COVID, a lot of the work that we've been doing as partners has really been to focus on delivering resilience around the system. So Patricia talked earlier about the work around the discharge hub that we had in place, where we had colleagues from the hospital, the community, and of course local authority partners working 7 days a week to keep the flow of discharges running through the hospital and ensure that we made sure that there was capacity for the sickest individuals. So over the last couple of months, there's really been a lot of very intense work done across partners on that, and some of the focus going forward is just making sure that we can maintain some of that in a slightly more sustainable way, because I think we made really good strides as to how we work together collaboratively on that. And I won't go into detail around the vaccination, because again that's just been covered in a paper, but a lot of joint working across all of the partners to try and reach as many people as possible in as shorter a time has been articulated. So I think, looking forward, really the focus is on recovery around COVID, and whilst we've been very much focusing on the sort of operational delivery, I think we've got a good chance now to think about maybe the longer term impacts of COVID and how as a partnership we look at that that impact and mitigating some of that. So particularly around the models of care for mental health, children and young people, maybe where there's been a slightly more latent impact of COVID on people's resilience, ability to cope, and not necessarily accessing services as early as they might have done had we not been just going through a pandemic wave. So really developing all of the neighbourhood working, so getting back our 6 neighbourhoods to be at the centre of delivering all of our population health with our community mental health teams, our primary care mental health teams, and working collaboratively with the local authority around that, and working through really how we have a joint health and wellbeing strategy that delivers all of that, all of those priorities, and really sort of make sure that the population of Hillingdon is in a good place going forwards with regards to the impact of COVID and the inequalities that some of that may have brought to light. So lots of work around that, and then also the work around some of the sort of broader transformation programs with the Hillingdon Hospital. Patricia gave the update earlier on the redevelopment work. And what we're really working on now at the moment is how we align all of those transformation programs together, so that rather than partners in one part of the room looking at all of the population health and discharge, and then partners in another part of the room looking at the hospital redevelopment, which the model of care sort of leads on from all of those conversations, is that we really bring that together and join it up in terms of how we articulate it, and then also in terms of how we deliver it. So that's really the focus going forward is sort of impact of COVID and recovery, and then focusing on all of the transformational change that gets us to a place where we have a suitable model of care that's fit for the future and fit for Hillingdon. So hopefully that's kept within 5 minutes and a whistle stop tour, but really happy to take any questions on things that I may have missed.
Sorry, Caroline, I'm not meaning that it's 5 minutes and nothing else. That sounds like I'm some sort of very, very cruel person, and I'm not. Congratulations, I meant to say to you on your new role, and those of us in Hillingdon are pleased to still see you here. So does anybody have any questions for Caroline? I can't see any hands raised. Thank you, Caroline. Always good to see you. In which case, we will now go on to the HCCG. That's either Dr. Goodman or Richard. I'm not sure which one of you is going to take that. Could somebody take that next item for me? Thank you.
Shall I begin? And I'm sure Dr. Goodman will add anything. I think the first thing to say from the CCG's point of view is that there is a lot of work ongoing supporting general practice in moving from their focus on day-to-day and urgent matters and the vaccination programme into resuming referral of their patients into secondary care and into other specialist care that might have been suspended during the pandemic. And I think we're all aware of the level of severe cases that primary and community services have been carrying during recent months. We're looking specifically as part of that at how primary care and secondary care can work together so that THH doesn't immediately receive high numbers of elective referrals, which then put a strain on the waiting list or on diagnostics or on theatres, or then again on discharge, as Caroline was saying, that has been so important in recent months. And we're also looking at the condition of long COVID and how that can best be supported again as a health and care partnership for both physical symptoms but also exacerbation of some of the other comorbidities that patients might have. And looking at what I think we all know will be some of the mental health and some of the social pressures that people have been carrying over recent months. So I think we will try and be doing that as a partnership across HHCP, across Hillingdon Borough, and across H4All, of course. And I suppose the specific item of news for the CCG is, of course, that as from the 31st of March, Hillingdon CCG will formally finish as an organisation, but will become part of North West London CCG as a single CCG for this patch. Clearly, all of our working arrangements with London Borough of Hillingdon, with HHCP, with the GP Confederation, with Health for All, with all partners, obviously will continue in exactly the same way. And we'll really hope to use the opportunity of the white paper and the emphasis on integrated care and integrated care partnerships on a place-based, on a borough basis, really try to use that as a springboard for doing more of what Hillingdon is obviously very good at, which is working together across boundaries. I think there are other areas I think to highlight in coming months. We understand from NHS England that the commissioning of dentistry and pharmaceutical services and optical services will be coming our way to North West London. And as we know more about that, we will obviously want to be discussing that with the Health and Wellbeing Board and looking at the opportunities that presents. But I think I'll finish there unless Dr. Goodman reminds me of things I've left out.
Dr. Goodman, do you want to speak now?
Richard really hasn't left out anything at all, really. Just to reinforce the point that general practice is open for business and shouldn't be turning anybody away. I know we are hearing stories of that, but in fact, every practice should be open. And although increasing numbers of consultations are virtual remote, it is still open. And practices have still been doing routine work for important services like childhood vaccinations and cervical smears. And from April, we're fully envisaging general practice going back to business as usual, because under the tier 5 level of pandemic, general practice suspended some of its local contracts around long-term condition management and that will be resuming in April the 1st, particularly looking after conditions like diabetes, asthma, heart disease, blood pressure, and those sort of things. So hopefully from April the 1st, we'll be going back to where we were before the pandemic.
Thank you, Dr. Goodman. That's really good to hear that GPs are open for business and still doing things as we thought they were. But it's good to hear that from a healthcare professional. Are there any other questions for Richard or Dr. Goodman? If not, Councillor O'Brien.
Thank you. And yes, sorry, just referring to what Ian has just said. So when we say that GPs are open for business, does that mean that you will be going back to what we regarded as normal pre-COVID, or because there does seem to be things like getting texts from them saying, oh, you've got to do prescriptions differently now, and do you want to do this online now, and can you get everything online? There will be obviously a large tranche of people that COVID or no can't move electronically. So when you say back to normal business, how do you see that working, or do you know how that's going to work?
So the concept of digital first, which is the NHS catchphrase, is going to stay with us. So for those of our residents who are digitally enabled, we expect them to use the digital services first. For those who aren't, which are the elderly, learning disabilities, mental health, then they're expected to carry on doing as they did before, either probably phoning up first, which is much more convenient. There will still be some COVID around in the community, so there will be some reluctance to come to surgeries anyway, less so than there has been in the past. So it'll be a hybrid model in many ways.
Thank you. I can't see any other hands raised. Okay, so I'm going to move on to the reports. London Borough of Hillingdon, does anybody want to say anything there? Who wants to speak? Anybody? Dan, have you got anything else to add?
I suppose it's in terms of the sort of the COVID update, there's nothing further. I suppose if in Tony Zayman's absence, I think what Tony would be saying is about the positive steps forward, working with North West London. And I know recently at that conversation I had with Tony, he's looking forward to working even more so with colleagues and opening up the conversation about the health and wellbeing partnership locally and our review of our own health and wellbeing strategy. So I think it would be a very positive message, I'm sure, on behalf of Tony about some of the new partnerships. And I think certainly that I can see it from where I'm sitting. The North West London collaboration and Caroline's appointment is all very positive and strengthening our local partnership. So it's a very positive message from me.
Thank you. Sandra Taylor, I think, is here. Sandra, do you want to speak?
I would just reiterate what Dan has said on behalf of Tony, but in terms of a brief update from social care from the council's perspective, the COVID could not have been managed in the way that it has if it wasn't a really collaborative approach by all partners involved, and it's been really, really supportive on all sides, I think, to get things done for Hillingdon residents, and our focus and the priority of getting work done for them has shown real rewards, and I think that that's such a positive thing at this point in time. But where that leads us to now is how to use, as Dr. Goodman was saying, how to use what we've learned through the pandemic in terms of our recovery, and not really to step back. Caroline highlighted around hospital discharge and the improvements that we've managed to make about getting people out of hospital in a much more expedient way through both phase 1 and phase 2 of the pandemic has meant that we've made people's time in hospital much shorter, and we certainly wouldn't want to go back on that. So the lessons learned have been really positive. From a social care perspective, the council hasn't used any of the easements open to it. We'll start to look forward and start doing face-to-face visits again as the roadmap to recovery from the government allows us to, and everything will be risk-based. So we'll do what we need to do in the right way at the right time, so that everyone keeps safe and people's anxieties can be managed. And the thing for us to concentrate on now, I guess, is about managing the mental health and well-being of those that will be recovering, both from our staff perspective and from service user perspective going forward, so that we have a good recovery.
Thank you very much. Yes, that's something that we will need to look at, I'm sure, as a board, the mental health recovery of our residents. Anybody else from the London Borough of Hillingdon want to add anything? Can't see. Yes, Sharon, of course. Please go ahead.
Right. I haven't really got that much to add. It's just that public health, I suppose, it's sort of in the background, working across both the local authority and also other partners. But I think for me, what I've seen over the past months, year actually, since we've actually been dealing with the COVID, is the way in which the whole system has actually been working together in a public health way. It's really very heartening to actually see how everybody's actually worked together to contain the virus and to protect the population. I think everybody should be commended for the work on which they've actually done. And I think it's also looked on favourably by Public Health England as well, because we do get positive feedback as well from Public Health England and our colleagues in the health protection teams as well.
Thank you, Sharon. I think, I'm going to say it yet again, this is something that we need to take forward. I will mention it a little bit later about the restructuring of the board, but we have a very, very good thing here in Hillingdon that we need to continue working, because we're showing the way here with how to link together to keep residents safe. So I'd like us to hold that theme going forward into the rest of this year. I don't think there's anybody else, so in which case I'll go on to Vanessa Odlin, who's here this afternoon on
Dan
behalf
Kennedy
of
has his hand. Chairman,
Dan
Kennedy has his hand raised.
Sorry, Dan. Apologies.
That's okay. It was only a final point. Thank you. And just obviously with schools returning or reopening for all pupils from the 8th of March, I met with a selection of head teachers last Friday just to talk through their reopening plans, so to speak. And I was pleased to hear, and not surprised to hear, that they were all well prepared with their testing arrangements and their communication with parents. They've been placing information on their websites, and proactively contacting parents to make sure that parents are well informed about what the arrangements are, and the usual reminders in school about social distancing and not coming into the classroom, etc., etc. So it was really just to offer some reassurance to the board that from my conversations with head teachers, they're well prepared for reopening from next week.
Thank you. And something else that's coming out from today is if we're well prepared and we inform residents and patients in advance of what we're doing, it is a slightly easier way to deliver whatever service we are delivering. Vanessa, I'm sorry about the previous. You are now free to speak. Welcome, and you're going to speak on behalf of CNWL.
I am. Thank you, Councillor Palmer. I would echo what everyone said in terms of the system working across Hillingdon, and actually it's making my job slightly easier in terms of what I need to feed back, because as Caroline mentioned, a lot of things have probably already been covered, but some of the highlights from a CNWL perspective that I wanted to focus on was around the discharge focus. Obviously that's been a really big piece for us, both from a physical health and a mental health perspective, and to make sure that we have that patient flow moving through. Certainly the kind of approach that we're adopting is we're calling it a pull-out model. So we're trying to adopt our community team supporting people out of hospital to make that easier for people. And we've actually adopted some of the processes that have been set up by the physical health colleagues in our mental health services. So we really now have a system, a kind of system process with all agencies from Hillingdon supporting our discharges out of the mental health wards, which, as you can imagine, is sometimes quite difficult and complex. Some of the other things that we've been enabled to do in Hillingdon is flex some of our services, which have included flexing some of our inpatient capacity. So on our older adult mental health ward, we've been able to flex some of those beds to be able to take patients who have got both physical health and some maybe complex mental health difficulties, to again support patients being discharged from Hillingdon Hospital, which has been really beneficial. We've also enabled our intermediate beds on the Hawthorn unit to take more unwell patients out of Hillingdon Hospital, and for me that's been a real kind of staff effort, and massive thanks to our staff there. Some of the great stuff that we're doing really in CNWL, but actually it's an HHCP, so Hillingdon Healthcare Partnership piece of work, is our high intensity user program, so supporting people who are turning up to the hospital more than once or more than twice a year, to kind of try and think about what we can do in the community for them. We're flexing our rapid response team in CNWL to think about how we put them, where we place them to support discharges and keep people out in the community as much as possible. And also the new, or not so new, service called the Coves, which is a more a kind of non-medicalised crisis service for people to attend in the community in Hillingdon to try and support people when they're in crisis. So certainly from my perspective, we're really trying to kind of think about how we can approach people in crisis very differently to try and either prevent them going into hospital, but certainly staying in the community. Some of the stuff around, so people will know that for our CAMS services, we are seeing an increase in our CAMS in presentations in children who are becoming more unwell. And what we've put in place in terms of CAM services is we've currently got a triage line for professionals to phone to support professionals who are maybe having to pick up the pieces for some of our young people. So very soon we will have a crisis line for young people to phone themselves. So we're just in the process of setting that up, and hopefully we'll have a date soon for that starting, which I think will be excellent. In Hillingdon, we've actually doubled up our duty team to support emergency response for young people, because we know that's something we need to do. That is temporary at the moment, but we'll see how that goes. And we are also looking at our service for people who are 18 to 25. So we know that we've got more money coming through, so we're looking at what services we may need to put in place for the kind of more 18 or 16 to 25 age group. I think probably I guess the kind of final thing to say is also supporting our staff and staff's wellbeing. So we're setting up something called a check and chat service, which was really good in wave one for patients and carers, and we're actually putting in a check and chat service for our own staff in CNWL. So it's really just a kind of informal chat line for people to phone if they're really struggling, especially for our staff who are shielding and maybe having to work from home, and maybe they're struggling but don't want to use some of our own mental health services, and they may just want to chat with someone. So we're putting that in, as well as a number of other wellbeing services for our staff in CNWL.
Thank you very much. Can I just ask a question under the service you highlighted there about children referring themselves? How will that be publicised? Because I suppose what I'm thinking about is if it's natural children's mental health is suffering, if they're not naturally seeking help. Publicity in mental health is essential, isn't it? That we have all these services going on, but possibly it's not until we're ill ourselves or one of our friends is ill or we get to hear about the actual service. So how have you thought about publicising that to children? Because I know we use Couth at the moment, which has proved to be very successful. How would you think about publicising that one, please, Vanessa?
So once we've got all of the details and the services set up, that's something that I would be coming back to, certainly to the HHCP and colleagues, to ensure we've got. So for me, communication doesn't need to just come out of CNWL. We need to kind of use all of our routes to make sure that you're right, that it's accessible and it's out there for people.
Thank you, because I think, you know, we've got a great wealth of opportunities to link in with these excellent services, and that's what I would be encouraging. Councillor O'Brien, I think you've got a question.
Thank you. Yes, I have two questions, but probably it all runs along the mental health side of it. Sandra and Vanessa very kindly mentioned about discharging and the focus on discharge. I suppose for me and on experience, I mean not now, but a few years ago, when we're talking about our hospital discharges and now how we're managing to use this new approach whereby you're expediting the move, does that mean that that there will be older people firstly in being able to be discharged without actually being held up on the ward? I don't want to use the word bed blocking, but that's a word that's been used where you've first-hand experience of seeing people sitting on wards for 3 and 4 and 5 and 6 months because they're in dispute about finding care home places. And are we saying that is now, hopefully with the way that we've moved through COVID, that's going to be a thing of the past, which obviously I would be delighted and welcome that, as obviously would all of the practitioners around the table. And the second question, I suppose, is that to Caroline, that in connection with CAMS and all of the things that you're able to put into place now because of COVID, how do we see you know, the doubling of the duty team going forwards? How do we see the triage into professionals? I mean, how long have we got the people, the funding for us to be able to bring this into the 21st century? CAMS has had to do an awful lot of catching up for a very long time for whatever reasons. How can we actually make this now a positive service moving forwards like this? Thank you.
Would you like me to start responding to the discharge piece? And I don't know if Sandra, you want to come in if I miss anything off that you want to add in. So I absolutely hope, Councillor O'Brien, that it is a thing of the past that people are remaining in hospital 5 or 6 months longer than they should. I think that the systems that we've put in place in terms of the in terms of discharging and the model we've put in place, I think that enables us to be very aware of people as soon as they're medically optimised, and that's the medical term that's used. But as soon as someone's ready to leave hospital, that we're made aware of it. I can't sit here and say that there may not be times when it's more complex for some people to leave hospital, but I think we've got the right people sat around the table to make sure that happens. Or if there is a problem, at least we're all sat around the table and people have a place to kind of almost bring someone into if there are difficulties with just discharging people. Sandra, I don't know if you think I've captured.
Absolutely, I'd concur with what Vanessa is saying. It makes such a difference for people to leave hospital even a few days earlier than they would have done. And it's made a real difference to the recovery of those people being picked up in the community. Lessons learned from that are about what is needed in the community and making sure that the services that we have are the right services to receive those patients back into community settings, be it a residential setting or be it at their own home, with the right level of support to allow them to leave that bit earlier than they would have done previously. So it's a very positive step, something we probably would have got to at some point over the kind of this year, but COVID has insisted we do that very much sooner, and it has worked, and why would we go back? So it's a real positive step for patients. Thank you.
Thanks, Sandra. I was just going to say, you know, if there could be anything good out of COVID, actually, I think it's forced this to happen, and let's not lose any of it. That's certainly the message that Caroline and I were talking about over the last couple of weeks. That let's not lose anything that we've gained, and let's not go backwards.
This has the potential to go forwards. I don't think we can look at going backwards.
Yeah, absolutely.
We have to go forwards. This pandemic has opened up all sorts of opportunities for better working out of sad circumstances. Caroline, did you want to say anything, or has the question been answered, do you think?
So I think in terms of, there was a specific question around the CAMS funding, I think, wasn't there? Was there, Councillor O'Brien? So I think it's actually the broader question is around the resourcing for anything that's been stood up through COVID. So a lot of the services that we've been looking at delivering have been through redeployment or through looking at what we can do differently with the resources available to us. And as a system, we've been able to do that quite quickly and quite effectively. And it builds on the conversation we just had. We don't want to go backwards. So I think it's really around us as partners, but also as part of the North West London ICS, articulating what good looks like for our young people and our population. So how do we therefore find the funding and the resources to deliver that? And is it by doing something differently elsewhere in terms of the models of care that frees up capacity and allows us to redeploy some time and clinical support into those duty teams, but it's something that I think we stand a better chance doing as a partnership than we did as standalone organisations. And I know that, that as part of the ICS, the Children and Young People's Programme have got this up at the top of their priorities as well. So it is something, you know, sadly it is a need that we're seeing across the patch in terms of young people struggling. So it's certainly acknowledged as something where we do need to target resource and our energies into improving access and outcomes. So from that perspective, I think it's an open door. It's just making sure that we have the right models in place to really pick people up as soon as possible and hopefully before they get to the point of needing acute care. And I think that's some of the exciting things that we could do is look at the early intervention and prevention work, so that, you know, ideally that's the point at which we get involved and try and mitigate the point of people reaching a crisis. So
yes, I mean, having worked in the voluntary sector for a long time, and I think, you know, the trauma of suddenly realising you've got to go in hospital and possibly lose your house. I always used to feel that if we'd had conversations with people before it got to that traumatic place, it would be still difficult to receive, but a little bit easier. I think the worst thing is having to deal with an illness and then not being in a position to come out, or being in a position to come out and you can't. I mean, Sandra made the point, it's better to come, if you're coming out early with a well-planned discharge, that does so much for your mental health. So I think there's lots, I mean, the people in front of me now on the screens, we've got lots of experience that we can use to make some real changes here. Thank you very much, Vanessa, for standing in for Graham. It's much appreciated. I don't think there's any other questions, and if there aren't, I'm going to go on to Nick Hunt from the Royal Brompton and Harefield. Good afternoon, Nick.
Chairman, Nick's had to leave the meeting, I'm afraid.
Has he now?
Sorry.
He sneaked off without me noticing. Okay, I'm going to go to Lynn, because I can see Lynn Hill in the top left-hand corner of my screen. Go for it, Lynn.
Thank you, Councillor Palmer. I'm going to be really brief because a lot of this has already been touched on. I mean, obviously, we worked really considerably and closely with the Hillingdon healthcare partners on our survey, which we undertook over a period of time. We We had 5,600 responses. We also went out to places such as REAP, the Refugees in Effective Active Partnerships, just to try and understand a little bit more about vaccine hesitancy. And we got some very good feedback on people's concerns regarding fertility, asthma, diabetes, possibly changing their DNA, being tagged. And we've been able to undertake quite a lot of significant myth busting with the local population and with the 150 faith leaders that Dan Kennedy referred to try and get the uptake much higher across our patch. And I think we were very successful. We also, just touching on the last piece of work, we undertook a piece of work with our young people, our Young Health Watch, doing a mental health and wellbeing services review. And they reviewed 14 bodies of information and services that actually didn't require a referral, to see what was out there for young people and to see where they can seek additional help and support by themselves, giving them the empowerment to take care of themselves. We produced a short promotional video on that, which is online, which has been also very well received. We continue to play a significant part in signposting patients. We are still there for patients every day by telephone, helping patients to navigate through the system. We've played a part in directing people to the various vaccination sites and helping them to get appointments. And people are now starting just to think about coming out of the other side with COVID and what's going to happen when normal services respond, and about their appointments that have been delayed. We've had particular interest in orthopaedics and ophthalmology for some time, and more lately inability to access dental services. So that's what we've been doing in a nutshell. Happy to take any questions.
Thank you very much, Lynn. Are there any questions for Lynn? Can't see any. Thank you very, very much.
Thank you.
Oh, Councillor O'Brien's giving you a round of applause, Lynn. That's
thank you.
Oh, and a double thumbs up. Lovely. Have I missed it? If I've missed any partners that haven't spoken, please unmute and go for it. Otherwise, I think I might have covered everybody. Does that look like I've covered everybody, Nikki?
Yes, Nick. It does, Chairman. Nick's fine.
Apologies, I'm looking at Nick Dennis's name on the right-hand side. Thank you very much, in which case we will go on to agenda item 9, which is the board's business for the forthcoming meetings. Just to say that we've deferred the proposed health and wellbeing development workshop for obvious reasons. I'd have hoped it might have happened by now, but we all know why it hasn't. I'm going to suggest that we look for dates again around May, assuming we all want to meet virtually. I'm not sure how that will pan out, but I think what I'm going to do is to ask that Kevin and Tony and Caroline finalise. I'm going to ask for some dates to be sent out to you all, and I would ask for some cooperation. I think we're in a really good place at the moment to move this board forward into some really, really good work. And I would hope that we can keep the good work that we've done going forward. So I'm going to suggest that some dates are canvassed. We've got other areas of work to report to the next board in June. The joint health and wellbeing strategy, which we could also talk about that in the workshop. We've also got CYP emotional health and wellbeing, early intervention through CAMS. Could we have an update? I'd like an update and a situation report at the next meeting on that, please. Perhaps HHCP and CNWL together would be helpful. Also, something I suppose that I've had some conversations about recently. I have had a conversation with Sharon Day on this, the child healthy weight. it's likely that overweight and obesity will have exacerbated during lockdown. I think that's just a common sense answer. It's not meant to be a criticism in any way. But with children not being at school, I know there's work underway, but I would like an updated plan with some sort of proposal about how we can go forward with this, because I think this is imperative that we go forward. Councillor O'Brien, did you want to speak there, or are you just waving?
I do, Jane, but I want you to finish whatever it is that you need to say first, so apologies, but it is on that particular item.
Do you want to speak now on it? Say it now.
Apologies, I feel like I'm pushing in now. I'm so sorry.
No, if you were, I wouldn't let you. Go for it.
Thank you. I have had a number of conversations with head teachers in infant schools and have spoken to, had a word with Kevin Byrne about this. I believe that finally, trying to do a little bit of homework of my own, that dental health for children comes in under the child healthy weight update, the obesity strategy, whichever it is. There is a big problem in infant schools, in primary sector, I should say, but mainly I've been speaking to the infant sector in connection with young children. Number one, not knowing how to brush their teeth, and number two, not being encouraged to brush their teeth. And if it's possible, I believe there was work that was done a couple of years ago with this. I wouldn't mind seeing that previous paper, and if we could, is it possible to actually bring that up in the agenda as well, as part of the dental health message, as to how we can get into schools and get our young people understanding that when mum says but they don't really like brushing their teeth, we can change that message and say it's not about what they like, it's about what really needs to be done. Children have got no teeth at the moment, some of them.
Thank you, Councillor O'Brien. Valid points. Also, can we keep hospital rebuilds high on the agenda here? I want to, I'd like the issues surrounding that to be kept alive at this meeting, really, and not come to me as a surprise, I suppose is what I'm saying there. I want everything warts and all before this board. It is our board, so any future agenda items, it's not just about what I say, but that's where I am with it at the moment. Does anybody have any other comments to make on that particular agenda item? I don't think I can see any others. If not, then that probably brings this part of the meeting to a close, I think. Does it, Nikki? And we go into part B.
Yes, if everybody can please remain on mute while I cut the live broadcast, please, and I'll let you know when I'm done. Chairman, we are